So, Josh, this is a perfect question for you, isn't it?
There are people who are working on this, and in fact, the work that we're doing is very related to that. So the first thing we're looking for are what are the proteins that are recognized by people who've had or who have breast cancer, and do they identify specific proteins? And then some of those proteins are actually being tested. One of my collaborators, Karen Anderson, we're doing some work on vaccinations for cancer. It's been hard going, to be honest. It's not been an easy area of research, but you can definitely demonstrate immune responses, and you can definitely see that in some cases they correlate with improved outcomes, or at least reduction in disease. But I can't say that right now we have a vaccine that works yet, but it's an area that people are definitely working at hard.
So a frequent question we get in the clinic in the last couple of years is, gee whiz, how come there's a vaccine now for cervix cancer? Gardasil, you've all heard about it in the news, and there's not for breast cancer. I'm setting the panel up, but somebody will easily explain to you what the difference is here, right? Who wants to do that?
So, at least to my knowledge, there are no infectious causes of breast cancer, unlike cervical cancer, where we know that there are viruses that specifically induce that response. So, at least for what we can tell in breast cancer, there's no known infectious cause.
So the nuance is we're vaccinating against the infection, and by preventing the infection, we are in turn then preventing the cancer. And that's a holy grail in part in breast cancer. But where we started with the notion of breast cancer not as one disease but as many leads you to understand why that will be an ongoing challenge. Related to that, how many of you have young children who have had hepatitis B vaccine in the last few years? Standard, right? So that vaccine prevents them from getting hepatitis B, which is the acute thing you're looking for. But the downstream effect is they don't get hepatoma, which is the most common, or at least one of the most common lethal cancers worldwide, because hepatitis B is the proximate or the long-term cause. So vaccination is possible. It's something that's very exciting, but it requires unlocking the key to understand what the real provocation was. And for breast cancer, we may end up with a collection of risks or factors, not a single one. We may have to vaccinate for different types. It's even conceivable, I think.